Today's video tip is about a cataract surgery nightmare. Hi, come on in. I'm Gerald Oginski, a New York medical malpractice and personal injury trial attorney, and today I'm going to tell you about a woman from Brooklyn who was told she needed cataract surgery. She had slight blurriness in one eye and went to the doctor and was told, you need cataract surgery. Now, cataract is simply a clouding of your lens of your eye, and there are two things you can do to take care of that. One is actually nothing. Just let it sit and wait until it gets really bad. Two, you can have surgery where the doctor takes out the lens in your eye and puts in an artificial one known as an intraocular lens. Well, she had that done, and the following day when she went back for follow-up, she couldn't see anything out of that eye. And over the next 2 weeks, despite going back for follow-up and taking medication to reduce the swelling in the eye, she still couldn't see anything out of that eye. The doctor began to question whether or not the calculations he made to give her the strength for the lens that he put in were accurate. He told her, I'm going to take you back into surgery, even though it's only 2 weeks later, and switch out the lens with a new one, with a different prescription. That's known as an intraocular lens exchange. We take out the first, put in the second. Well, the doctor had significant complications taking out that first lens that he had put in only 2 weeks earlier, and then putting in the second one. And after the second surgery, the patch was taken off the day after, she still couldn't see. Now, over time, she continued to go back to the doctor for follow-up visits, taking all the medication they told her to, still no usable vision. She had some light coming in, but nothing that she could actually see out of and get any usable vision out of. She ultimately lost faith in those doctors and went to New York Eye and Ear Hospital, where they told her, you have permanent damage. You have damage to your cornea, you have damage to your retina, and there are other problems. You're probably going to need a corneal transplant. The doctor was defiant. He said, I did everything I was supposed to do. I did everything right. I calculated everything correctly. It was our claim that the doctor, number one, never should have recommended this patient for cataract surgery. Number two, he never should have performed the surgery because she had near perfect vision. So now, I said to him at his deposition, at his question and answer session, I said, why couldn't the patient see following the first surgery? And his answer kind of shocked me. He said, because of some unexplained and unexpected result. I said, what do you mean unexpected? Everything you do in this procedure as a board-certified ophthalmologist is known. There should be no surprises here. And if you expect to have some complication, then it's your obligation as the eye doctor to minimize those risks. He could not explain why this patient had no usable vision following the surgery. And it was just last week that both parties decided 1 week before trial to go to mediation, where both sides appear and attempt a negotiated settlement. And I will tell you that after 3 hard-fought hours, we were able to successfully resolve this case for $725,000. Now, why do I tell you this? I tell you this because if you have similar situation involving cataract surgery gone bad, then I want you to pick up the phone and call me because I can answer your legal questions. You can reach me at 516-487-8207 or by email at lawmed10@yahoo.com. And by the way, if you found this video helpful with the information in here, then what I want you to do if you're watching this on YouTube is click the button below that says like. This way all your friends will be able to watch and hear this video as well. I'm Gerald Oginski here in New York. Thanks for watching.